Thyroid problems are epidemic in this country. Many people, men and women included, suffer from subclinical hypothyroidism, which is low thyroid function. The symptoms of having low thyroid include weight gain, fatigue, hair loss, dry skin, constipation, feeling very sluggish, which is fatigue times 10. Some people lose the outer 1/3 portion of their eyebrow, and it also affects mental functioning. Thyroid symptoms can affect the entire body. The problem with thyroid testing today is that the reference ranges for thyroid are much too broad. So what happens is that there may be a person who has low thyroid function, but they're still in the reference range, which means that if they go to their conventional doctor, they will be told that their thyroid is normal. This is not the case, and in fact, in 2009, the Board of Endocrinology actually lowered the reference ranges for thyroid because they recognized the importance of having an optimal thyroid level. It is possible to balance thyroid function naturally. However, it is important that a person go to a practitioner who can understand all the different elements that feed into compromised thyroid function. There are many reasons that a person's thyroid could go low. The first one that we need to think about is elevated cortisol, which is our stress hormone. In 2010, many people are under stress. In fact, I don't know one person that isn't under stress. So elevated cortisol suppresses thyroid function. Other items that suppress thyroid function are environmental toxins. We live in a toxic world. If more and more toxins come into our system, they actually affect our hormonal systems, including thyroid function. It is important when you go to a practitioner to have them help you with thyroid problems that they are able to look at all the different things. It's not black and white. You have a thyroid problem, you don't. Okay, great. But how we treat it needs to be very comprehensive in order for the person to feel better. Standard conventional treatment for thyroid disease is synthetic thyroid hormone. It comes in the forms of Levoxyl or Synthroid. Synthetic treatment is only T4. There are two main thyroid hormones, T4 and T3. T4 is not the active form of thyroid in the body. T3 is the gasoline. When a conventional medical doctor only gives a person T4, that doctor is assuming that the body will be able to convert T4 into T3. That is not always the case, considering that their metabolism and other things are not working, which may have caused the thyroid problem in the first place. So it's much better actually from a natural standpoint to supplement with T4 and T3 to give the person who is tired, fatigued, sluggish, dry skin, constipation, the active gasoline to get their thyroid up and functioning. Treatment for thyroid, often a person can start feeling better once they're on the right dose within 7 to 10 days. Sometimes it takes a couple of different trial runs to get person on the proper dose of thyroid. Additionally, many people are deficient in minerals, and there are a couple of key minerals such as iodine and selenium that actually help support thyroid function. So they may need to build up their mineral stores as well.